What is the result of that? What does that mean is happening?
This is a thromboembolic disease. What does that mean? COVID is a clotting disease. COVID is a clotting disease. COVID is a clotting disease. Now, when we give a spike protein, to Dr. Malone's point, that is an active biologic molecule, we chose the wrong molecule that causes disease. So what do I see under the microscope? You see these COVID skin cases, these weird COVID rashes. What is that? That's clotting in the skin. When I get the autopsy tissues now from my colleagues around the country, these patients that, we have unfortunately doctors that say there's no damage from the vaccines and no deaths from the vaccines. We should use the French legal system. When we have a new product that's never been used on humanity in the market, it's guilty until proven innocent. Every time there is damage or disease from that product, we need to assume it is until we prove it isn't. So under the microscope, we see clotting in the lungs, we see clotting in the vessels, we see clotting in the brain, not from the virus, but from the spike from the vaccine itself. Now consider the numerator and the denominator. Are most people going to be fine? Yes, and I want to emphasize that. In our data around the world, from the United States, from the UK, from the Eurovigilance in Europe, we have seen more death and damage from this one medical product than all other vaccines combined in the last several decades, in just a short 8-month window of time. It has done more damage than any other medical product, therapy, shot, modality of anything we've ever allowed to stay on the market to this point. Do I mean to sound alarmist? No, I'm being factual. And when I look at it under the microscope and I see the parts of people or people that are no longer with us, the damage and the disease is caused by that spike protein. It is present.
Common sense would tell me, you can't tell me a vaccine's efficacy is debatable.